Hello, I'm Leif Hallberg, and I am a horse trainer and riding instructor turned licensed mental health professional, researcher, and author. And today I'm going to be talking to you guys about including equine-assisted activities and equine-assisted therapies as a part of an integrated model of care for military veterans and active duty service members. So when we get started, what I'd really like to achieve today is to have you understand essentially how an integrated model of care functions and why it's so important for military personnel, and also how equine-assisted activities and equine-assisted therapies can fit into an integrated model. I'd also love to cover scope of practice laws and title and term protections and the possible risks that violations of either of these might cause to participants and the industry as a whole. And we will discuss the uses and key differences between equine-assisted activities and equine-assisted therapy service types and how those relate to veterans and active duty service members. And I'm hoping that at the end of this, you'll be able to recognize and critically evaluate the current state of equine-assisted activities and equine-assisted therapies research related to military populations. So I'm excited to be with you today, and this recording is a little bit new and different for me, so I'm used to seeing your faces. So I'll have to get used to this, and hopefully it will become a little more comfortable as we go through the presentation today. So again, welcome, and I hope that we enjoy this learning journey together. To get started, first we have to understand what an integrated model of care actually is. And it has a couple of different parts that I want to cover today. But generally speaking, an integrated model of care is seamless service, the provision, essentially, of seamless service through integration and communication. And all of the services are coordinated or managed to ensure that the patient receives the help that he or she needs during all stages of the wellness journey. And an integrated model of care includes all types and levels of services and service providers. So it's like a tapestry of services that guide and help somebody as they move through the process of healing and growth and change. So what's included in an integrated model of care? First of all, we have assessment. And assessment's probably maybe one of the most important parts of an integrated model of care, because assessment helps us to understand where someone is at in their healing journey and to evaluate them across all spheres of function. So when we talk about spheres of function, we're talking about physical health, behavioral health, recreation and social engagement, vocation, and lifestyle. And so assessment essentially helps the entire team to focus on the individual needs of each veteran or active duty service member. And without an assessment, it's sort of like flying blind. You don't really know what's going on with somebody, and so you don't really understand what the best way to address their situation it might be. And so assessment really guides and moves us forward on this path towards healing. So assessment is essentially a formal process conducted by a trained healthcare professional, and it's used to evaluate, like I said, all spheres of a person's functioning. And the results of an assessment, they are used to generate an integrative healthcare plan. And that is the document, essentially, that acts as the roadmap to a wellness journey. And the next part of the integrated care system is addressing physical health conditions. And essentially, physical health conditions or physical health services are services and treatments that are used to address ailments and illnesses that affect the human body. The next component of integrated care model is behavioral health. And behavioral health includes all the services that promote health and wellness, and also treat mental illness and substance abuse or other addictions. Rehabilitative services are a vital part of this model, especially for veterans and active duty service members. Rehabilitative services are services that help to get back, or improve skills and functioning for daily living that have been lost or impaired because of illness, injury, or disability. Recreational and social engagement is also a very important and vital component of this model of care. We look at health across a continuum, and these services, recreational and social engagement services, are extremely important to the overall well-being of somebody. And so they include non-regulated and non-healthcare services that promote fun, exercise, learning, and social engagement. Essentially, all of these components put together create overall or whole person wellness. And when I think about the integrated model of care, I also think about all of the complementary and alternative services that can be used as a part of that model. So please don't rule those out. Those are very much a critical and important component to whole person wellness. So that gives you just a sense of the totality, or the scope of this sphere of integrated wellness. So then we have to ask ourselves, how does it all work? When you have all of these different components included in human health, how do they fit together? And how do providers work together or collaborate to help make sure that the journey is relatively smooth and going in a forward direction for the individual? So the first part of that, as we discussed, is assessment. And so assessment occurs both for physical health care, assessment occurs for behavioral health care, assessment occurs for recreational, social engagement activities. And it's really the first step to understanding what the veteran or active duty service member needs across all of these different spheres. And assessment will allow the treatment team to really determine which services to include and at what point in the treatment process. So the first avenue we'll go down is physical health care. So assuming that the veteran or active duty service member requires some sort of healthcare, physical healthcare service, the team will essentially assess and determine what services are needed and how to go forward. And think of the physical health care, think of the primary provider, the primary healthcare provider, as essentially like a quarterback. And he or she is going to be who really dictates and helps to direct all of the services that occur in an integrated model. And including behavioral health care a lot of times, including rehabilitative care, including recreational or social activities. So this is kind of an important component, is to think about somebody really managing the entirety of these healthcare services and guiding and directing those. So the primary care physicians are the ones that would typically refer to rehabilitative care, typically refer to behavioral health, and potentially even refer to recreational or social engagement activities. And many times they are, like I said, they are the first line of defense. So it's especially important that the physical health, the primary care physicians are savvy, are really cognizant of all of these spheres, so that they understand and they can assess across all of these different areas of function. So next we have rehabilitative care. And so for this, I think, is extra important for especially for returning veterans. Many times their needs include learning to cope with changes to body form and function, as well as adapting to new vocation and to integrating into civilian life. And so these services can be extremely essential for veterans. And then physical, occupational, and speech therapists and other rehabilitation specialists are also on the front lines when it comes to essentially referring to behavioral health care. So they may quickly pick up or recognize issues that necessitate referral to behavioral health care, as you can see through the purple arrows there. And they may also be the ones that refer to recreational or social engagements, recognizing that the veteran or active duty service member needs additional help and support and resources in that area as well. So sometimes from the assessment process, the veteran or active duty service member will be directly referred to behavioral health care rather than physical health care. Their presenting issues necessitate that type of referral, and then the behavioral health care, the licensed behavioral health care professional will be the one that potentially refers outwards or to other additional services, which is why you see the green arrows working up towards the physical health care and down towards the recreational or social engagement activities. So the behavioral health care professional might determine that, in fact, they have physical health care needs or rehabilitative health care needs that need to be attended to, and so they would refer back to the primary care physician for potentially a referral to occupational therapy or speech therapy or so on and so forth. In many cases, it's for veterans or active duty service members, behavioral health care is probably one of the very most important aspects in this sphere, this integrated model of care, just especially given the presence of complex PTSD, acute stress disorder, regular PTSD, and the co-occurring issues that could potentially occur there. So it's a very important part of this entire spectrum. And then finally, assessment might occur between from two recreational or social engagement activities. And so this would be an area that is important to address, in that these types of activities are critical for the function of this whole system. And just because they are provided by non-licensed individuals doesn't in any way decrease their importance or their vital role in this whole system of care. So essentially, when I think about all of this, I think about a continuum of care. And I think about how all of these services are a part of this whole that leads to full health or whole person health. So all of these different pieces have to be in place, and they're required at different phases or stages of treatment. So what you might see is that somebody starts with physical health care, like seeing their primary care physician or getting PT, OT, speech therapy, or maybe they start with behavioral health care and then they move to recreational or social engagement activities, or maybe they start with recreational or social engagement activities and then they move to behavioral health care. So there's a fluidity between all of these areas that's really important to recognize and to consider when you're thinking about the role that each of these different providers play in the health and wellness of a veteran or an active duty service member. And one of the chief ways that this whole system works is through active engagement and communication, and that everybody provides services that are within their scope, that they're trained and educated to provide, and that they stay within their sort of lane, if you will. So there isn't duplication between services. So in other words, the behavioral health person isn't providing a service that the recreational or social engagement individual or provider is providing, and vice versa. So each of these different areas, or again with rehabilitative care, that the PT or OT isn't providing the same service that the behavioral health care person is providing, or that the recreational or social engagement activity provider is providing. So everybody has their own little niche. They have their own place. They have their own skill set that they are trained and experienced and educated to provide. And so when all of those things work together, that's when I think that's when the magic happens, and that's when people really start seeing the benefits of an integrated model of care. So why is an integrated model of care especially important for veterans and active duty service members? The first and most obvious component of that, to answer that question, is that it's actually required by the VA. So the Department of Veterans Affairs now requires that VA centers and community-based clinics offer integrated services, especially integrating behavioral health care with primary health care. That's an absolutely essential component of this. And the reason for that is to more effectively diagnose and treat acute stress disorder, post-traumatic stress disorder, complex post-traumatic stress disorder, and really hoping to reduce some of the risk for suicide. So it is a requirement now by the VA that an integrated model of care is utilized. And then the second component that's very important is that an integrated model of care addresses co-occurring conditions. Now, the vast majority of returning veterans who have been diagnosed with PTSD are also diagnosed with additional co-occurring conditions. And those include suicidality, depression, substance use disorders, other addictions, neurocognitive problems, anger and violence, which includes sometimes domestic violence, abuse, grief, chronic pain, sleep issues, homelessness, relationship issues, vocational issues. So all of those things are essentially could be occurring at the same time for a veteran or active duty service member. And an integrated model of care is perfectly set up or suited to handle that complexity, and having all the different service providers in place working together to address all of those, creates a much more comprehensive model of care and gives really provides the services necessary. So the final component is probably the most important at this point in time. An integrated model of care helps to prevent suicide. Now, as I'm sure all of you are aware, the statistics are overwhelming and certainly concerning. So 20.6% of veterans or active duty service members die by suicide every single day. 16.8 of these are veterans and 3.8 are active duty service members. That's data taken from the 2015 National Suicide Data Report from the Veterans Association, administration, sorry. And I think that one of the things that is so profound about those numbers is that the risk for suicide of returning veterans and active duty service members is 2.1 times greater in veterans and active duty service members than in civilians. Just think about that for a minute. It's almost incomprehensible. And then women and veterans and active duty service members being twice as likely to die by suicide than men. So certainly for women, it's even more concerning. And these suicide rates have increased for both veterans and non-veterans between now and between 2012 and 2015. And that really underscores the fact that this is a really significant issue. Now, some other interesting statistics. The suicide rate increased faster among veterans who had not recently used Veterans Health Administration healthcare over those that had. So this seems extremely important in terms of making sure that veterans have access to healthcare and that healthcare addresses their issues across all of these spheres. So it's not enough just to address a physical health issue, but there's also the need to make sure we're addressing behavioral health care issues simultaneously and social and recreational needs to make sure that the individual is getting all of the services and help that they need. So the integrated model supports the idea that the more trained eyes and ears on a veteran or active duty service member, the better. So if all providers across all spheres of health are trained to recognize acute stress disorder, PTSD, the red flags of suicide, and all of the other issues that might be occurring for the veteran, and know how to use timely referrals. So for instance, if that information comes out, say in a service provided by a recreational or social engagement activity provider, that person knows how to refer the veteran to the right place and do that in a timely manner to help really make sure that care is in place as quickly and as effectively as possible. So how do equine-assisted activities and equine-assisted therapies fit into this integrated model of care? So from assessment to physical health care to rehabilitative care, we then see equine-assisted physical therapy, equine-assisted occupational therapy, equine-assisted speech and language pathology. And so let's kind of talk through this a little bit. So during the assessment process, the referral might be to, say, a primary care physician, who again, remember, is sort of like the quarterback of this whole system. And then that person may refer the veteran or active duty service member to a physical therapist, an occupational therapist, a speech and language pathologist to help address those types of issues. And at that point, then the licensed professional might either be trained and certified to include equines as a part of their regulated therapy service, or they might in fact refer out to a different physical, occupational, or speech therapist who is trained and certified. So I think that's one of the important things to remember, is that essentially including horses in any of those services, it doesn't change the service, nor does it change the route of referral. They're being referred for physical therapy, for occupational therapy, for speech therapy. And again, if that professional decides that it is clinically indicated to include horses, then he or she will do so themselves, or they will refer to the correct provider for those services. So just think about it as it is another, essentially it's another tool, not the horse itself, but the inclusion of equines and the equine environment is another treatment tool that these licensed professionals can use to address typical physical, occupational, or speech therapy goals. And I guess the most important part of that is that it's a very complicated and it's a complicated intervention that certainly necessitates a great deal of additional training and education to be able to provide. And that's important to note. So that is sort of where physical, occupational, and speech therapy that includes horses, that's where how that referral process happens. And so then the next component is behavioral health care. So again, just like with physical, occupational, or speech therapy, equine-assisted mental health is provided by licensed behavioral health care professionals like counselors, social workers, psychologists. And again, the referral would come to that individual. You know, the veteran or active duty service member needs some type of behavioral health care, like counseling or addictions counseling or marriage and family or social work or whatnot. So the referral would come from there, either from the rehabilitative care professional, from the quarterback, so to speak, or just directly from the assessment process. And then that individual would determine if equine-assisted mental health was actually clinically indicated, and if so, what model and what provider would be a good fit for that. And the other way that referrals come is certainly through recreational or social engagement activity service providers. So they may decide, they may see a need and say, oh boy, yeah, this person definitely needs to be referred to behavioral health. And again, and they might suggest, you know, the individual has a real fondness for equines or really likes being outside, so maybe equine-assisted mental health would be a good opportunity for them. And as I'm going through, I'm just checking my notes to make sure that I've covered everything, so don't mind when I'm looking off to the side to do that. And so finally, the other area in which courses are included in this integrated, or could be included in this integrated model of care, is through, again, the recreational social engagement activities, which includes adaptive or therapeutic riding, driving, or equine-assisted learning. And once again, everybody works together in this system. So nobody is operating alone. Everyone is a part of the team. Everyone understands from the assessment process what the treatment goals are, what this veteran or service active duty service member is needing to work through or work on or deal with from a health-related standpoint. And so they're all part of the team. They're all working together. They're all collaborating. They're all communicating. And they're referring between each other to make certain that this individual is taken care of. And the needs, of course, of this person, they're going to change throughout the course of treatment. So remember what we talked about earlier in terms of it being very fluid. So it's possible that for some time a person might receive equine-assisted mental health, but then over time it may be that they transition to equine-assisted learning because they don't need the clinical intentionality of equine-assisted mental health. Or vice versa, it may be that they start in therapeutic riding services and then they get referred to equine-assisted mental health. And same thing with physical therapy, occupational or speech therapy. There's clear passageways of referral between all of these service providers, and working together and working cohesively as a team and knowing when to refer, I think, are probably the most important components to an integrated system. So I would say that here there is some just kind of a word of warning or caution. I think that a lot of times the equine services get provided in isolation. I've certainly seen it happen, and I've read about it, and I've seen it online, and so on and so forth. And so what can happen is that a veteran can come in to, say, any one of these services, like maybe they get referred to a counselor who then decides that it's indicated to offer equine-assisted mental health, and they're being seen by that person, but they're not being seen by an occupational therapist or a physical therapist or even a primary care physician sometimes. And they're not, and so they sort of get stuck in this one sphere, and there isn't any collaboration or any sort of teamwork there. Or it's possible they come in to a therapeutic riding center, and maybe the therapeutic riding center feels like they can address sort of all of the needs of the veteran in one place, and they're not including a behavioral, licensed mental health or behavioral health professional, or they don't include a physical therapist. And so they're kind of trying to do everything themselves. And sometimes that happens just because of access issues, like there isn't anyone providing the other services. And so it can be limiting in that way, or it could be because of stigma. It could be because of the veteran or returning or active duty service members' own personal preferences. So there's lots of reasons why that can happen. But really, if you're the ideal situation is to provide integrated care. And integrated care means that all of these people are on the team and they're all working together to help that one individual. So we all have to, continue to work hard to sort of stay in our lanes, to know what it is we do and what it is we do really well, what we're allowed to do by law and by our scope of practice. And to know how to refer and to know how to connect with these other individuals and providers that could be really important assets for the veteran or active duty service member. So let me just check my notes, see if there's anything else I want to talk about in that area. Okay, so moving along. What's the difference between all these equine service types, and why does it matter? So what's the difference between regulated therapy services versus unregulated or non-regulated non-therapy services? Well, this is actually a very clear delineation, but it seems to cause some element of confusion, particularly in our industry. So we're going to try to keep this very, very clean and very straightforward. So regulated therapy services, they're provided by licensed healthcare professionals who work within their scope of practice. They're used to treat serious physical and behavioral healthcare conditions. They're regulated by healthcare laws, ethics, and standards, which we'll talk about later. Patients have to sign an informed consent for treatment. A treatment plan is developed and guides the course of services. Health insurance generally covers these services, and title and term protections apply. So non-regulated, non-therapy services, they're provided by non-licensed individuals who may or may not be industry certified. So that could be, in our particular industry, that would be therapeutic riding instructors or equine assisted learning professionals, et cetera, et cetera. In other industries, it's a variety of other types of individuals. The services are based off of recreational and social skills, and they're not used to treat serious physical or behavioral healthcare conditions. And of course, the industry itself is non-regulated, it's self-governing. So the non-regulated, non-therapy services they're not regulated and they are self-governing. But services must remain clearly outside the scope of practice of licensed professionals, which we'll talk about again later on. And there's no informed consent used because the services aren't considered therapy or treatment. There's no treatment plan used. A session plan or a list of participant goals could be used to direct services. And they're rarely covered by health insurance unless they're supervised by a licensed healthcare professional or required by in a treatment plan for some other reason. And providers must adhere to term and title protections. So hopefully that sort of just cleans it up and really gives a sense of the differences between regulated services versus non-regulated services. So let's talk about some terms that I just used. All right, so the term regulate, what does it mean? What the heck does that mean? So it refers to state-mandated laws set in place to regulate or govern a healthcare practice. Most common types of these state regulations include professional licensure, scope of practice, term and title protection, specific types of certifications that might be required by a state. And any healthcare provider who offers a regulated service must also adhere to specific state and federal laws and standards of practice. So examples of healthcare services that are regulated in all 50 states include physical therapy, occupational therapy, speech and language pathology, counseling, social work, and psychology. All right, so what does scope of practice mean? Scope of practice means the procedures, processes, and actions a healthcare provider is permitted to undertake by law in keeping with the terms of their professional license. Individuals who are not licensed healthcare professionals don't have a scope of practice, but by law, these individuals, non-licensed individuals, are not allowed to actually provide services that fall within the scope of practice of a licensed professional, or that even closely resemble those services. So this is certainly a challenging and somewhat tricky line, but it's important to really understand how that relates to our work. One of the best examples that I can give about this is looking at professional coaching, like life coaching or professional development coaching versus counseling. So counselors have a very specific scope of practice, and it's written out. Each state has a definition of that scope of practice, and those are all available online for every state. And so what happens is that if a life coach or a professional development coach were to provide services that too closely mirrored that of a licensed professional counselor, he or she could actually be held liable for infringement. And so it's just really important to understand what the scope of practice of these various licensed professionals are, and make sure that services that are provided by non-licensed professionals don't infringe upon those or don't cross over into that territory. So what's consent for treatment? It's a legal document that provides the patient with full disclosure regarding the potential benefits, risks, and alternatives to any medical procedure or course of treatment. This document also includes the evidence or lack thereof that supports the intervention, and any unique characteristics or circumstances that they may encounter. Patients and their legal guardians are required to review the document and decide whether or not they wish to receive the medical or mental health treatment offered, and then they have to sign it, showing their consent. So this is provided anytime you go to the doctor and you're going to, get some sort of X-ray or, test or a treatment protocol or procedure. You essentially are provided with information that says, here's what this procedure or test is all about. Here's the risks. Here are the potential benefits. And are you willing to essentially consent to this? And so when you're considering including equines in treatment, that is absolutely essential. And of course, that this document becomes much more comprehensive because of all the various disclosure needs related to including horse. Term and title protection. So what is that? Term and title protection relates to specific terms or titles that are protected by law and may be only used by professionals who meet state licensure and practice requirements. These protections are in place to increase consumer safety and raise awareness about the type of service the consumer should receive and the required competency standards of the individual providing the service. Violations of term and title protection can range from legal action to fines to confinement in jail. It's very serious, and I don't think we do a very good job about educating, especially in our industry, exactly what term and title protection means and how we might violate it, and how we cannot violate it, most importantly. And what has happened is there haven't, I don't think to date, been a whole lot of lawsuits that have occurred in our industry, but I would assume that the more providers enter into the industry and the more services are provided, we'll probably, unfortunately, start to see more lawsuits unless we can really get clearer ourselves internally about what terms are allowed and what terms aren't. So examples of protected terms and titles in most states that are relevant to us, to our industry, include therapist and therapy. So again, think about the term versus the title. So the title is therapist, the term is therapy. Physical therapist, therapy. Occupational therapist, therapy. Speech-language pathologist, speech-language pathology. Counselor, counseling. Psychologist, psychology. Social worker, social work. Nursing, nurse. These are all terms that are protected by law. So what that means is when people use the term equine-assisted therapy and they're using it to refer to therapeutic riding or equine-assisted learning, that's actually a title violation and is liable, which means that somebody could come along and sue or you for using the term incorrectly. And that we will probably not see that so much on an individual level, but we may see it on an industry level, like national associations that govern the practice of physical therapy, occupational therapy, speech therapy, or mental health may be the ones that start reaching out and saying, hey, that term is not acceptable, you can't use it, it's not acceptable for use in this way, and this individual can't use it, or this organization can't use it in that way. So it's just really important to start doing some further research and really understanding term and title protection law and how it relates to our industry. And doing some education, I think, around that will really help. Media sources are also held responsible for term and title protections. So certainly of late, there's been lots of articles published that misuse terms or suggest that certain services that are not therapy are actually, they're calling them therapy. And so these are things that the media also would have to be more, should be probably more attentive to, just to avoid lawsuits. And of course, the whole point of this is not about suing each other. It's about protecting the rights of the rights and welfare of our patients, of our participants, and that's what title and term protection is actually all about. Okay, so regulated equine-assisted therapy services versus non-regulated equine-assisted services. So now that we sort of understand the difference between what a regulated service is and what a non-regulated service is, it becomes really easy to classify or codify the work with horses. So clearly underneath regulated therapy services that incorporate equines is equine-assisted mental health, equine-assisted physical therapy, equine-assisted occupational therapy, and equine-assisted speech and language pathology, or equine-assisted speech therapy, as I shortened it to. So those are very clearly provided by licensed healthcare providers within whose scope it is to provide whatever the services that they provide. So for instance, for equine-assisted mental health, that's provided by a licensed counselor, social worker, marriage and family therapist, addictions counselor, occupational therapists are also allowed to provide mental health generally, and especially trained nurses or psychologists. So that's who gets to provide those services, and they are regulated. They are a regulated form of healthcare. And then similarly, equine-assisted physical therapy provided by licensed physical therapists, occupational therapy by licensed occupational therapists, and so on and so forth. So non-regulated equine-assisted services, so adaptive or therapeutic riding, driving, vaulting, those services that are provided by Path International certified instructors or other instructors that don't necessarily have a specialty certification. And again, remember, that's one of the key defining factors of a regulated service versus a non-regulated service. State law or federal law governs who can provide a regulated service. So not just anybody can provide equine-assisted mental health. It has to be by law licensed counselors, social workers, and so on and so forth as the list goes on. That's kind of the key component of a regulated service, whereas a non-regulated service means anybody can provide it. And there isn't any state or federal law or system of regulation that comes in and says this is who has to provide it. So same with equine-assisted learning. It's a non-regulated service. It can be provided by educators who are maybe credentialed, but also educators who are not credentialed. Life or professional development coaches, again, those might have industry certifications, spiritual guides, horse professionals. So it's a free market, and anyone can provide the service, and there isn't overarching regulation. Of course, PATH and various other industry-specific organizations help to provide some level of regulation, but it is not required by state or federal law. And finally, horsemanship for human development is another area that is provided by horse professionals, and that's not regulated. So we're going to look at these just a little bit more closely. So equine-assisted mental health. As we discussed before, it's provided by a licensed counselor, social worker, et cetera, et cetera. These are individuals that are also required to have additional education, training, and supervision in the application of equine-assisted mental health prior to providing it. And not just training specific to equine-assisted mental health, but also training specific to how do you apply equine-assisted mental health to this population. So when we're talking about veterans and active duty service members, for a licensed mental health professional, before adding a new population or a group of individuals to be served, one has to show that they have additional training to know how to work with that population, especially if it's outside of or it's a specialty population. So not only is it necessary to have training in equine-assisted mental health, but also training about how to apply equine-assisted mental health to that specific population. As I said before, it's used as part of a regulated mental health service to address typical or common mental or behavioral health care issues, including, of course, PTSD, anxiety, depression, addictions, serious mental illnesses, relationship challenges, phase of life issues, parenting, communication, and even everyday life concerns. Equine-assisted mental health includes the horse as a sentient and essentially ecological being which means that it's a horse, right? It's a horse with whom the patient can learn to form relationships. So that's one of the ways that it's included, is very much relationship-based and viewing the horse as sentient being and a horse. And then it can also, equine-assisted mental health also sometimes includes horses more as sort of treatment tools whose kind of used to invoke responses and reactions through activities that are typically non-horse skills based. So This would be sort of more like a ropes course or a challenge course where you create an activity and then the individual, the patient, engages with the horse and learns things through that activity. So it's not so much about the horse being a horse and sort of learning about the horse as it is about the horse as a potential activity or a way of engaging and learning about oneself. And equine-assisted mental health, there's lots of different models that licensed mental health professionals can explore when considering if they want to include an equine in their practice or equines in their practice. So there's lots of options, and those models, some of them work well for certain populations and some of them work well for other populations. So there's a lot of flexibility and an opportunity there. Now, equine-assisted mental health for veterans and active duty service members. So anecdotally, veterans are being successfully treated by equine-assisted mental health interventions for PTSD, ASD, complex trauma, reintegration issues, all of these different types of things. We hear a lot about how successful this intervention is through the media and through service providers themselves and through the veterans and active duty service members. And so anecdotal responses are usually sort of how the word gets out that this is working and how it's working. And sorry, there's a little bug floating around. There isn't much to be gained from the initial research data, primarily due to methodological issues and small sample sizes. So as of 2016, I conducted a really pretty large-scale literature review, and only of 350-something studies, only 7 were peer-reviewed published and conducted related to including horses in the care of veterans or active duty military service members, I mean. And so 3 of those 7 included or used a form of equine-assisted mental health, so if that makes any sense. So this huge number of studies, only 7 studied veterans or active duty service members. And then of those 7, only 3 looked at mental health. So of those 3 studies, one was a 2-day pilot project with 8 participants, and they investigated improvements to depression, anxiety, and reintegration. Another was a 6-week pilot project with 10 participants looking at PTSD. And one was a single participant case study investigating improvement to general psychological function. So again, due to methodological issues and small sample sizes and the lack of ability to transfer results, it's really hard to just conclusively come up with any, to say anything conclusively after those studies. So we know there's the work has started, which is really important, and we're starting to understand a little tiny bit more about how horses could be included for veterans, and certainly it's happening everywhere, and anecdotally it's working. Now I think the research just will have to catch up. So equine-assisted PT/OT, or speech and language pathology, it's provided. So here's the interesting thing. Unlike equine-assisted mental health, I have chosen to combine PT/OT and speech therapy into one slide, into one category. And the reason for that is that at this point in time, these 3 types of therapies, are not explicitly separated when including horses. So obviously, these 3 types of therapies are completely different. They're provided by completely different licensed professionals that have different training, different education, different licensure, all of these things. But they are kind of lumped together right now at this point in time, both in literature and also in practice. So at present, both the American Hippotherapy Association is who provides the training for these professionals, and the American Hippotherapy Certification Board provides the certification. And so again, with those 2 entities, there isn't separation yet between these different types of therapies and how exactly they include horses. So right now what we can say is that horses might be included as a part of regulated physical, occupational, or speech therapy to address typical physical, occupational, or speech therapy goals. And as per the AHA, all of these professionals include the purposeful manipulation of equine movement as a part of, as well as the equine environment as a part of the patient's integrated treatment plan. So there isn't a great deal of specificity in terms of how they do it, but we're very well aware that these different individuals are including equines and equine movement and the equine environment. And so then, how does it relate to veterans and active duty service members? As of 2016, there was not a single research project, peer-reviewed, published related to any of those forms of therapy and the inclusion of horses in those forms of therapy. But anecdotally, we know it's happening, and it's happening all over the place. So any of these three types of therapies could be used to treat a variety of ailments or impairments to body function, body structure, and certainly address occupational and mental health related goals. So anecdotally, the farm can also be motivating and a very enjoyable environment to receive these different services. And the therapists have at their fingertips a lot of different options when they're at the farm in terms of treatment activities and things to do with a patient that are creative and different than the office, but that address the same typical treatment goals that they would address in an office setting. Adaptive riding or therapeutic riding, including driving and vaulting. So again, we know it as a non-regulated, non-therapy service. It's provided typically by PATH International certified instructors or other instructors that don't have specialty certification. It's used as a recreational and social engagement service to improve quality of life through teaching horseback riding or horsemanship skills to those with disabilities or special needs. It doesn't seek to treat medical or mental health conditions, and thus is not referred to as therapy or treatment. I think the most important thing, again, to remind us all of is that each one of these services has such a valuable place in this integrated model of care. And just because a service isn't treating a mental health or medical condition doesn't make it any less important or any less valid. It's just different. So possibly one of the most commonly used equine-assisted services for veterans. Broad applications range from the recommended use of teaching skills and fostering recreational and social benefits to what I would consider the more questionable practice of addressing serious mental and physical health conditions through this non-therapy service. So I know you guys have probably all seen it, and you might even be struggling with it yourselves, trying to understand sort of where is that line between addressing or treating these serious conditions that a veteran might present with, or an active duty service member might present with. Where's that line between addressing those and really staying clear about it being a recreational or social skills activity that isn't addressing those things. So it can be very confusing, and the gray zone can be hard to differentiate and sort of sort out. But it still, I think, it is extremely important that we continue to do better and better at cleaning that up, and to make sure that treatment occurs by licensed healthcare professionals, and these recreational and social engagement activities occur are provided by non-licensed individuals and both are recognized as very valuable parts of the whole. As of 2016, 2 of 7 total studies were peer-reviewed, published, and conducted relating to including horses in the care of veterans or active duty service members, and they used adaptive or therapeutic riding. Of these studies, one was a single participant case study investigating improvements of an incomplete spinal cord injury. And the second was a pilot project conducted over 24 weeks, assessing changes in quality of life indicators and depression symptoms. So again, even here, you can sort of start to feel where it gets a little bit confusing and a little bit gray. Why is therapeutic or adaptive riding being used for these purposes, or why is the study being done using therapeutic riding? There's so many other important things that probably could be studied through using therapeutic riding. So lots of discussion and contemplation there. Equine assisted learning. So this is, again, a non-regulated, non-therapy service provided by educators, both credentialed and non-credentialed, life or professional development coaches, spiritual guides, horse professionals, and so on. It's used to promote life skills, social skills, communication skills, leadership skills, while also facilitating personal growth and increased self-awareness. These providers may use both mounted and non-mounted interactions with horses. And similarly to therapeutic riding, it doesn't seek to treat medical or mental health conditions and shouldn't be referred to as therapy or treatment, given term and title protections and all the stuff we already covered. So equine assisted learning for veterans and active duty service members. It's less common than therapeutic riding, but there is definitely a growing interest. Especially, it seems, for active duty service members who may benefit vocationally from leadership skills and enhanced communication skills. It doesn't mean that it wouldn't be beneficial for veterans as well, but certainly I've seen it, I've heard about it and seen it used in this particular way quite frequently. And it could also be used to work with teaching some parenting skills or some other reintegration skills that could be really helpful. Similar to adaptive or therapeutic riding, it may be implemented as recommended, meaning that it's implemented as a non-therapy skills-based service. But in some cases, it could be used sort of inadvisedly in place of therapy to treat serious mental health issues. So we do see that occasionally where equine assisted learning is used in place of equine assisted mental health, and specifically to address like PTSD and some of the other really serious mental health conditions that veterans or active duty service members might be struggling with. So as of 2016, one of the 7 total studies regarding veterans that was peer-reviewed published was equine assisted learning was used, and the study investigated improvements in PTSD symptoms, relationship issues, communication skills, and conflict resolution in 31 veterans and their spouses. So again, this is one of those areas where it's, it gets a little bit confusing and gray in terms of how exactly the equine assisted learning service was conducted and how in its facilitation, how it differed from equine assisted mental health. So that's a very important area of distinction, and an area that we all are, I think, trying to improve upon and get more clear about. And finally, there's this sort of yet to be defined but emerging area, which I'm calling, or we're calling, horsemanship for human development. And this is really an area where horse people are teaching horsemanship skills to veterans and active duty service members, and it's sort of a side effect, is that it fosters human development skills. So it is not considered equine assisted learning in that the primary purpose isn't to foster skills, but rather to teach horsemanship skills. And if, in fact, through teaching horsemanship skills, the person gets some additional benefit, that's really valuable and important. And again, of course, these services wouldn't seek to treat any medical or mental health conditions and wouldn't be referred to as therapy or treatment. There's no literature at present about this area of service, but it's certainly more common than I think people might think. Many outdoor programs for veterans include horseback riding and horse interactions. And certainly they learn horsemanship skills through those interactions, and those can be directly applied to life. And I also wonder, because there is really no perception of therapy or treatment, and it's clearly recreational and social, and even maybe more so than adaptive or therapeutic riding might come across, I think that this might be an appealing service to veterans as a way of engaging with horses, but not experiencing any of that perceived stigma. So it's certainly an interesting area to pay attention to and sort of notice how it's developing and how it's being used with veterans or active duty service members. Okay, so here is a link to to the lit review that I referred to. It includes over 350 peer-reviewed articles. It's available on my website, so you can just go to www.hallberg.com and look for the lit review there. It's divided into sections under conditions or populations treated, so I think it's a very valuable resource, and please feel free to hop online and have a look at it. All right, so now we've gotten to this stage of the game here. And we have to ask ourselves, why does all of this matter? Why does it matter what we call things? Why does it matter who has what training? Why does it matter how we differentiate? Well, the thing is, when especially when working with veterans or active duty service members, everything matters. So the first step of this dynamic is the right service. So just to give you a sense, I'm going to look down at my list of statistics here, just to give you a little bit of a sense of this. Between 10 and 30% of all veterans and active duty service members have been that have been studied, of course, have been diagnosed with PTSD, and that's opposed to between 7 and 8% of the civilian population. So just think about that for a minute. And those are statistics provided by the VA National Center for PTSD. And statistics tell us that the majority of individuals diagnosed with PTSD also have co-occurring conditions that complicate their situation. And one of the most concerning complications or co-occurring conditions is the prevalence for suicidality, and particularly in this population. So what that means is that providing the right service to these veterans and active duty service members to get the help that they need when they need it is absolutely vital and life-saving. So we don't want to provide the wrong service at this point in time. We really, really want to make sure that the service is really the service that is needed and indicated. There's an amazing document, amazing resource that I'll share with you when we get to the resources section. It's called the Department of Veterans Affairs and the Department of Defense Evidence-Based Practice Workgroup Clinical Practice Guidelines. That's a mouthful. It's available to all of us, to the public online, and I cannot recommend it more. It's such a helpful and comprehensive document. And anyways, in this particular document, they show statistically that offering the wrong service to veterans or active duty service members can either be ineffective or can even in some cases be harmful. So it's extra important with this particular population. And also, according to this document, since equine-assisted activities and equine-assisted therapies aren't considered an evidence-based practice, and in fact, none of our existing research even met the threshold for inclusion in this particular document, so they couldn't even review the existing research to determine whether or not it might meet the criteria, because the research itself didn't meet the criteria. The design of the research was too poor. So essentially, all of us that provide equine-assisted activities or equine-assisted therapies, we've got to be even more careful, because we aren't certain, we don't have the backing really of research right now to show that that our services are really going to work well for veterans and be safe for veterans and so on and so forth. So we just need to be extra careful and surround ourselves with a highly educated and experienced team to make sure that the services are appropriate and that we don't do any additional harm, like causing trigger responses or, providing services in an unsupported environment. So having the team around us, making sure we're providing the right service and making sure we know how to refer is just absolutely essential. And then, of course, we want to make sure that the service is delivered by the right provider. So clearly, if a person needs behavioral health care treatment, that needs to be provided by a licensed behavioral health care professional. And so understanding who that is vital. That isn't a non-therapy equine assisted learning person or spiritual guide or any of the following. It doesn't in any way mean that those people aren't incredibly good at what they do and might be able to help the veteran immensely, but for the sake of safety and to really be ethical about the way we provide services, it's just so important that we are referring to and we make sure that the services are provided by the right type of provider. So, and certainly in considering recreational and social engagement activities, I would say equally, we would want it to be a PATH certified therapeutic riding instructor that's providing therapeutic riding rather than somebody that has no certification or industry training. So these are the kinds of things that we just have to be clear about and prepared to stand up for, I think, nowadays. So one other piece I want to say about that is that there is lots of times some confusion that mental health professionals can provide equine assisted learning and mental health professionals can provide therapeutic riding. Well, the important thing to recognize is mental health professionals are required to remain within their scope of practice and to only provide services that they're trained and educated to provide. So for instance, if a mental health professional is duly trained in providing learning services like experiential education or professional or life coaching, they could potentially provide that service, but they have to be extremely careful when they do so, that they are not bringing their mental health background into a life coaching or professional development coaching realm or into a therapeutic riding lesson. So, because remember, if it's a therapeutic riding lesson, that person hasn't signed an informed consent. So it's not okay for the mental health professional to come in there and maybe ask probing questions or try to discuss, issues that would be considered, more appropriate for a mental health setting. So it doesn't just work one way. It's not just that non-licensed people have to stay out of the scope of practice of licensed people. It's also that licensed people have to stay within their lane too. So we all have to do, I think, we all have to do a good job of that. And maybe for some of us, we all need to continue to work on that and do the best job that we possibly can in terms of really knowing what we offer and what we're allowed to offer and staying within that scope. So remembering that the laws do require that certain professional types, licensed professional types, can only offer certain services, and non-licensed individuals can only offer certain services, and that is actually enforceable by law, given term and title protections. Okay, so then we got to address the right services. So the right issues. So we got to use the right services delivered by the right provider to address the right issues, if that makes any sense. So it's sort of what I was talking about in that when a veteran or active duty service member comes to, say, a therapeutic riding session and they start talking about maybe some suicidal ideations, or they start talking about abuse that they have experienced or trauma, that is not the right issue for that particular service or that particular service provider. And so that's when referrals have to happen. And that's when knowing how we delicately and kindly and compassionately move a participant to the right place to get the right help that they need needs to occur. So certainly it doesn't mean shutting them down and saying, gosh, we can't talk about that here or whatnot. But it really means saying, boy, that really sounds like we should maybe consider bringing in so-and-so, and gosh, that sounds like an issue for so-and-so or whatnot. So there's a lot of training that can be done in terms of really sorting that out and knowing how to do referrals in a really kind and compassionate and graceful way. But we all need to be doing that. And again, remember that even with licensed people, it may be that even a population, if we don't have the additional training to work with a specific population or a specific type of issue, then we're not allowed to do that by law. We need to refer to somebody who does have that training and area of expertise, or we have to get the training ourselves and be supervised as we're offering those services. So it goes all ways. And finally, it has to happen at the right time. So what that means is that we might deliver a service at the wrong time during a participant or patient's treatment process, right? So it may be that they get referred to therapeutic riding when in fact they really need equine assisted mental health. Or they may get referred to equine assisted mental health when they really need equine assisted occupational therapy. So we have to put all these pieces together. And when we do, we have to really pay attention to what the outcome is. And even though we might want desperately to provide services for this person because we think we can help them and we really want to help them, if these 4 things don't line up, then we need to figure out, we need to do the work we need to do to get them to line up. So we need to look into what is the right service, who is the right provider, what are the issues that the individual is facing, and where are they in their treatment process. And so if these things can line up, then we know we're going to likely do a really good job for somebody. And when we're using an integrated model of care and we're bringing all of the service providers together, these 4 things are much easier to accomplish because we have a team around us that can step in and that we can ask for help. We can say, wow, I really think that this service is going to be valuable to this person, but it's not valuable right now. And so right now they need you and they need to address this issue and they need to do it in this way. And we would love to have them back when that piece has sort of been worked through, and then my services can be more helpful or whatnot. So, and some of that is guided and directed by the primary care physician. Some of that is guided and directed by each of us as service providers, and some of that's guided by the individual, the patient or participant himself or herself, saying, hey, this is really what I need right now, and this isn't feeling good to me, and I'm not getting enough of this or whatnot. So again, these 4 things are critical elements to be considered, carefully considered, and worked through when providing integrated services. So let me see here if there's anything else I wanted to address before we end today's presentation. I've really enjoyed working through the challenges of presenting in this way, and I hope I made some sense. It's probably the hardest type of presentation for me to give. I really love interacting with the audience and responding and reacting to what you guys are thinking and hearing and feeling. And I know I'll get a little bit of a chance to do that when we are together on the day of the conference. So I look forward to hearing more from you when we're live. But after that, I think really I just want to share some resources and then conclude. So this gives you, these are just some of the resources I used to develop this presentation. Everything is available online. It's all free. You can just get on there and download some of these great resources. You can also feel free to email me or contact me directly, and I can give you more of the resources that I use. But this just gives you a little taste of what's available. Thank you all so much for listening, and you can reach me here at my email address or online at my website. So again, thank you, and I hope this was helpful.
Now, let's take a question. When you talked about asking about the worst and best day of their service, I was wondering at which point in the relationship you can ask a person this. Seems like it would take a certain level of rapport, or is it something you can ask fairly soon in building your relationship?
Such a good question. I saw that one come across, and I was sitting here with my clinical team. We were talking about it. Obviously, you do want to be a little bit careful about kind of entering these kinds of conversations with people when you don't know them at all. But what you can ask people right away as you're getting to know them is something like, tell me about your most memorable day in service, right? So as you get to know them better, you could ask specifically about your best or worst day, but a lot of times we'll just say, what's the day you remember most from your military service? And I think the point of this question is just to, again, show veterans that you know enough about their culture to ask. Similarly with, I think I say early on in the presentation, ask which branch. ask what they did in the service. And I think the reason for that is that you're then explaining to them with one question that you know enough about their culture to know to ask the question. So this is a similar thing. It's just getting to know people a little bit better, and I think that is something that obviously you've got to use your judgment a little bit. But I think asking someone to tell you about their most memorable day in service, you can pretty much usually consider that to be something you can ask right away.
Okay. Now, I see a comment in the session discussion saying, as a spouse of 38 years, I was happy to see the inclusion of the family piece. We have a question here regarding that. How can you incorporate the family more to decrease the feeling of abandonment felt especially by the military spouse?
And I'm assuming this is asked in the context of providing equine therapy for people, which all of your folks are doing. I think that what I have always tried to do in my clinical work with veterans is to ask the person, is it possible to include your family in this? And I think that all of you could do the same. You could start, as you're getting to know your relationship with this veteran, you could certainly start by saying, I'd really appreciate getting to know your family and learning how they relate to your experience and what's going on for you. Just like anybody else, really. Veterans aren't different than anyone else in this way. It's always important to incorporate the family. And then I think if the person is deploying, or if you're working with someone that's active duty and that person deploys, having the family then stay involved with the program keeps them connected. So I think it's a wonderful idea from the very start to include them. It seems like it's a win-win across the board to me.
Okay. Well, continuing with family involvement, the next question is saying we're inviting families to be present on our farm during equine sessions, and we will have trained volunteers available to guide them with activities on the farm, such as walks in the woods, creating ag craft, collecting eggs, playing with goats, etc. What are some good and safe questions that these volunteers can ask the family members?
Oh, good idea. Good question. I think what I would probably recommend is starting with the same questions that this presentation told you to ask veterans. So, your dad's in the military. What branch was he in? Right? So that you're showing this family from the very beginning that you understand the culture enough to ask what branch and what does he do in the Navy or what does he do in the Marine Corps? What's his job? Right there, you're showing them that you understand. And then I think then it's okay to say, tell me about what it's like to be the daughter of a Marine, or tell me about what it's like to be the wife of a soldier. Again, I just think you can't go wrong with wanting to hear about that particular experience and how that's different and how it approached the person.
First question is asking, does the VA cover EAP for PTSS or just PTSD?
Well, EAPs are employment assistant programs, so I'm not sure if this is a VA employee that asked the question. But as far as VA coverage, that is a question that continues to be worked on as we speak about the idea of post-traumatic stress symptoms versus those that fit criteria for post-traumatic stress disorder. At the moment, my understanding is that benefits are provided for the diagnosis, the disorder. Certainly there are treatment opportunities available just for the symptoms, but for the benefits themselves, that is still have to fit criteria for the disorder. I think we're trying to, the whole world's trying to move towards an understanding of these symptoms being on a continuum. So we'll see whether that changes as we go forward.
Okay, and with that, it looks like we've exhausted all the submitted questions, but we have just a moment left. Any parting thoughts you want to leave us with?
Yes, I saw multiple people asking, how do I use this video? So this is a hour-long version or a 50-minute version of a video that we also have a 15-minute version of. It's called 15 Things, and it is the shorter version of this. If you go to psycharmor.org, you can see any of our courses. They're all free, including 15 Things, the shorter version, and this one, the longer version. And they are certainly available to you at any time. If you want to share them with a whole group, what I would recommend is writing to us at PsychArmor. I think Rachel shared the email, and letting us know that. We want to share this with our whole team of volunteers. And what we'll do then is hook you up as a team where we can help you get the word out to your team of the courses you want them to watch. Again, everything's free, but that allows us to be able to tell how many people are watching them and what kind of impact they're having.
Okay, and with that, Heidi, I want to thank you for, again, a wonderful presentation. I think we all got a lot out of it.
Thank you. I appreciate that.